Today we're going to talk about vitamin K2. K2 is a member of the fat-soluble group of vitamins. That includes vitamin A, vitamin D, vitamin E, and another form of K called K1. K1 is something that's found in green leafy vegetables, and you need it for proper blood clotting. K2 is a different version of that. K2 is something that you have to properly use calcium. When you eat calcium in your diet or you take a supplement, the calcium gets absorbed into the bloodstream and it has to go somewhere. K2's job is to grab that calcium and shuttle it to the bones, where it activates a certain protein that basically puts that calcium into the bone and builds up the bone mass. That's the way your body is supposed to work. 99% of the calcium that's found in your entire body is found in your bones and your teeth. It's kind of like a storehouse of calcium. So you need that K2 to get the calcium from the bloodstream into the bones where it belongs. And that would work fine if you have enough K2. A lot of people don't, as it turns out. It turns out vitamin K2 is something that's traditionally found in one of the best sources, is butter from grass-fed cows, which we used to eat a lot of, and now nobody does that anymore too much. Certainly not grass-fed, because a lot of people don't eat that kind of butter, or worse, people are eating margarine or things that aren't even real. Other sources of K2 are liver and egg yolks and some soft cheeses, but generally people don't get very much of it, and there is a pretty widespread deficiency of it. So without that vitamin K2 being there ready to grab the calcium and put it in the bones, something else happens. The calcium kind of just wanders around your bloodstream, and if it doesn't make it to the bones, it will end up in different soft tissues, which are like the arteries, the brain, the lens of the eye, the kidneys, in women, breast tissue. Those are all soft tissues where calcium shouldn't be there, it should be in the bones. So lack of K2 generally results in calcification of those other soft tissues, and that's a huge problem. You think of arteriosclerosis, hardening the arteries. There's calcium in those arteries. That's one of the things that's making them hard. In women, calcifications in breast tissue, it's a big problem. They're finding in Alzheimer's patients that calcification is one of the main factors of it. So there's more to learn from this whole on this whole topic, but K2 is kind of a missing link that needs to be addressed. So the issue is, people will take calcium to try to do it as a supplement to help with osteoporosis, obviously, and then they're taking vitamin D, which is good because you need vitamin D, and most people don't get enough of that. But without the K2 to get it to put the calcium where it's supposed to go, there can be problems. They know that people who take calcium supplements do have a lower rate of osteoporosis, but they actually have some higher rates of heart disease and hardening of the arteries. And it seems to be as a result of that deficiency of K2. So we do encourage people, anybody who's taking a calcium supplement or anybody who is taking vitamin D, really look into this K2 thing. Look on the internet, find other sources of information. Get a K2 supplement, to safeguard that. There are different versions of K2 in supplements. It gets a little complicated. The one you want to look for is something that's called MK7. It's called menaquinone, and that's the version that stays in your system the longest. There's some other versions that don't last very long, but look for MK7 when you're getting a supplement. They're not that expensive, and it is something that it might be of great benefit, especially if you're taking a calcium and vitamin D supplements. And thank you very much.